Tim, thank you. There are almost 21,000 cases of the coronavirus in Maryland. Nearly 1,000 people have died. Hospitalizations and the number of people in the ICU are also increasing. The state will not begin to reopen until those numbers flatten. Governor Larry Hogan issued a new order to fight this virus in Maryland's nursing homes. WJZ is live. Amy Kawada has details about that executive order. Good morning, Amy.
Good morning, Lynn. It's the governor's latest initiative. He's now ordering mass testing at all nursing homes across the state in order to fight the coronavirus.
We are no longer just playing defense. We are going on offense against this virus, attacking it from every angle with everything we've got.
Governor Larry Hogan says a new executive order targets outbreaks at nursing homes, requiring universal testing of all patients and staff. He warns nursing homes must comply with state law. It also requires daily evaluations of these facilities.
It is heart-wrenching enough that families can't visit their loved ones, but it's even worse when they can't get information about what is happening inside these facilities.
Maryland Senate President weighed in on a virtual meeting.
I hope that we are learning the right lessons with nursing homes, because it's probably the tip of the iceberg of kind of isolated communities that are in close proximity, that when things spark, it can get out of control really quickly.
On the economic front, Hogan says the new unemployment website has fallen short, and he's taken responsibility.
It is simply not good enough. The IT contractor who developed this site and the Department of Labor have fallen short of the high standards that we have set. And the people of Maryland deserve better, and the buck stops with me.
And the governor says the 500,000 tests he and the First Lady obtained from South Korea will be distributed throughout hotspots across the state. But some members of Maryland's congressional delegation fear we don't have the capacity to process them all. Also on Saturday, the governor wants the entire state to light up in blue to show support for our frontline healthcare workers. Reporting live this morning, I'm Amy Kawada for WJZ.
Thank you, Amy. 6:35 now. Those major changes at nursing homes come after so many have expressed concern over how quickly the virus can spread at long-term care facilities. WJZ is live this morning. Mike Hsu has reaction to the governor's executive order. Good morning, Mike.
Good morning, Tim. Nursing homes in Maryland account for more than half of the COVID-19 fatalities here. Now, with this new order, in order to have universal testing, there is one family that tells us that is good, but it comes a bit late.
The spotlight is back on nursing homes in Maryland. A new executive order mandates the testing of residents and staff members, even if they're not showing symptoms. While helpful going forward, those who have relatives in such places say this new mandate comes a few weeks too late.
It should have been done for at least the last 3 to 4 weeks.
Those living and working at nursing homes have been hit disproportionately hard. The state reporting more than 500 residents and 8 staff members have died from the virus. That's more than half of Maryland's total COVID-19 deaths. Rick Manthai says his father was living at the Pleasant View nursing home in Mount Airy when the coronavirus outbreak began. So far, it's left more than 100 residents and staff members infected and 29 dead. For a month, Manthai's dad battled the virus and has just tested negative.
We could have really lessened the deaths in, especially Maryland, if we would have done more with nursing homes as a focus.
The new order requires residents to be evaluated every day and their families to be informed. The order, also by Governor Hogan, has set up strike forces of nurses and aides that will go in to help nursing homes who are becoming overwhelmed. I'm Mike Hsu reporting live in Mount Airy for WJZ.
Dozens of people have reached out to us about the new online system for unemployment. Some users say they spent 7 to 12 hours in just one day trying to get through.
No money, no debit card.
I've been given no paper checks.
Neither of us have anything in our accounts.
I've received nothing in the mail.
Terrible, awful, frustrating.
The system is one of the first in the country and should be a one-stop shop for anyone who needs unemployment benefits. Governor Larry Hogan says Maryland is now activating 33 accounts per minute. The Labor Department told WJZ since the launch of the Beacon One-Stop application, more than 245,000 accounts have been activated. More than 100,000 new claims have been submitted.
For people fighting COVID-19, there are psychological effects. Johns Hopkins has a team specifically designed to work with these patients. Members of the team say coronavirus patients sometimes deal with anxiety even after defeating the virus.
Something sort of special about our COVID patients is they are telling us when they're headed home that they might be a little bit worried about things like COVID stigma. So fear of the loved ones and the people around them of becoming ill. And they're also afraid of infecting other people.
Since COVID-19 is a relatively new disease, doctors are still working to see how post-intensive care syndrome, is what it's called, affects virus patients. They say it affects up to 70% of people who live through a critical illness.
Patient First increases access to testing for Marylanders. The urgent care chain says its Belair Road location in Perry Hall will now offer drive-up testing. People who want to test can make an appointment, but must be experiencing at least one symptom of COVID-19. They will be able to stay inside their car during the process, and results take 2 to 4 days to process. Testing will also be available 7 days a week.
We know now that personal protective equipment, or PPE, is critical right now for those working on the front lines of this pandemic. And now there is a new facility up and running in Baltimore County to help keep up with demand. County Executive John Ilshevsky and representatives from LifeBridge Health got to tour the facility yesterday. Johnny O got to see what's being made up and talked about the important work that's being done.
And we know that we have healthcare workers are among our most important frontline workers. And so what you see behind us and around us are employees taking care of employees, producing the face masks and the gowns and the other necessary PPE that's required to keep our health workers safe.
This factory is located right across from the Northwest Hospital ER in Randallstown. WJZ has everything you need to know about this pandemic, and all you have to do is go to WJZ.com and look under top stories for a list of the resources. We've put them all together, and the most important links and numbers are under quick links.